After I graduate, I plan to work at a hospital. One area of patient safety that I focused on is falls. Every semester when in clinical, I have noticed that every specialty I've worked in has had some issues with falls. For example, in the oncology unit, there was failure of bed alarms being set and patients were falling. On the OB unit, there was a nurse who fell asleep with a baby in her lap and the baby fell, resulting in a fall. A patient fall is defined as an unplanned descent to the floor with or without injury. Between 700,000 to 1 million people in the United States fall in a hospital. About a third of these falls can be prevented. One intervention I came up with is creating a culture of no one walks alone. A hospital in San Diego studied this intervention, and they found that patients often feel embarrassed to ask for help to get up, or they place a high priority on privacy. Through this approach, every patient is considered a fall risk, so bed alarms are on for all patients regardless of their age. Nurses or CNAs have to assist patients every time they get out of bed. This eliminates patients feeling embarrassed to ask for help since everybody else is also getting help. Nurses will then chart in the electronic health record every 2 hours that the bed alarm is set. I thought this was a fair amount of time since every hour would be too difficult as nurses are always busy and 3 hours seemed to be too long. This intervention relates to the high reliability principle of preoccupation with failure, which means acknowledgement of the high-risk, error-prone nature of an organization's activities and the determination to achieve consistently safe operations. So realizing that falls are high risk and the organization being determined to achieve a safe environment for all patients. This intervention essentially does not cost anything as bed alarms are already available in hospitals. It would require teaching staff members of the new policy change. This teaching can be performed during team huddles and through an email as a reminder. The intervention would be performed by nurses, LPNs, CNAs, or techs. They could all ensure that bed alarms are on and help nurses out by charting that they were on. I would implement this by educating a team leader on each floor. They would then relay the message to all team members during team huddle. An email would also be sent out to all staff, and every nurse would need to sign off that they were educated. To measure the intervention, I would first track the number of falls prior to the intervention. I would do this for each floor. I would then track it 1 month later to see if the intervention worked. I would track each floor because then I would see if one floor was successful and if one wasn't, and figure out what was successful in that one floor or what was a failure on the other floor to help make improvements.